NREMT practice question number 15. You and your partner are performing CPR on a 3-year-old female who fell into a pool. Which of the following cardiopulmonary resuscitation techniques are considered appropriate? Choose 3 correct answers. Your options are 30 compressions in 2 breaths, full chest recoil after every compression, continuous compressions and ventilations once an endotracheal tube is placed, compress at a depth of 1.5 inches or 4 centimeters, ventilate the patient once every 3 to 5 seconds for rescue breathing, minimize interruptions in compressions to less than 10 seconds, or switch compressors every minute. If you need more time to review this question, pause the video now. The answer will be revealed in 5, 4, 3, 2, 1. And the correct answers are full chest recoil after every compression. This is because no matter who your patient is, you do need to do full chest recoil after every compression. Because full chest recoil allows the heart enough time to refill with blood so that when you compress again, blood can leave the heart. The next correct answer is continuous compressions and ventilations once an endotracheal tube is placed. The American Heart Association guidelines require a compression to ventilation ratio to be used until an advanced airway is in place. However, once an advanced airway is in place, continuous compressions and ventilations must be used. The third answer is minimize interruptions in compressions to less than 10 seconds. Because anything less than that would increase the chance that the brain and other vital organs would go too long without perfusion, which will result in a decrease in neurological status if ROSC is achieved. Now let's go over the wrong answers. 30 compressions in 2 breaths is used for single rescuer CPR regardless of the age of the patient, and switches to 15 compressions in 2 breaths for 2 rescuer CPR on a pediatric patient. Considering that you and your partner are performing CPR on a 3-year-old, you are dealing with a pediatric patient, and there are 2 of you, so the correct compression ventilation ratio would be 15 to 2, not 30 to 2. Compression at a depth of 1.5 inches or 4 centimeters is used for infants. However, you're dealing with a child, not an infant. If you didn't already know this, the American Heart Association states that anybody who has not yet hit puberty, generally under the age of 13, is considered a pediatric patient. However, they further define pediatrics as anyone less than 12 months of age being an infant, and anyone who's over 12 months of age but has not yet hit puberty being a child. So, the 3-year-old is considered a child, not an infant. Therefore, a compression depth of 1.5 inches or 4 centimeters is incorrect. What would be correct is if they said compression depth of 2 inches or 5 centimeters, because that's the appropriate compression depth for a child. Ventilate the patient once every 3 to 5 seconds for rescue breathing is incorrect because in 2020, the American Heart Association changed their guidelines and now recommend ventilating a patient once every 2 to 3 seconds for rescue breathing, not once every 3 to 5 seconds. Lastly, switching compressors every minute is incorrect because we need to switch compressors every 2 minutes. Although the American Heart Association does allow you to switch compressors sooner if necessary, for example, if you recognize that a compressor is not doing an effective job and you need to swap them, you absolutely should do so. However, you should never plan on switching compressors every minute or sooner than 2 minutes. You should only do it if it's necessary in the moment. So again, having a compressor switch every minute is not correct. Let's go over the correct answers one more time. The correct answers are full chest recoil after every compression, continuous compressions and ventilations once an endotracheal tube is placed, and minimize interruptions in compressions to less than 10 seconds. If you found value in this video, make sure to give it a like. And for more NREMT practice question videos just like this, make sure to visit and subscribe to our channel. If you're looking to pass the National Registry Cognitive Exam yourself, make sure to visit our website, howtonremt.com, to get your membership today. With your membership, you'll get lifetime access to a free practice app that has hundreds of questions that mirror those on the National Registry exam. 1 year of unlimited live group tutoring with an instructor who will teach you exactly how to pass the National Registry exam, access to our videos and content that will teach you everything you need to know to dominate and pass the exam, and of course your membership will be backed by our 100% guaranteed to pass or 100% money back guarantee policy. So again, make sure to visit howtonremt.com now to get your membership, and don't forget to use code DOMINATE at checkout.